Today I'm doing a head and toe assessment. It's being conducted by me, Fred Page, Immersion University nursing student. I'm doing it on Sunday, October 25th at 2 o'clock in the afternoon. I'm going to begin my head and toe assessment by checking my PCP orders and patient care plan. Then next I'm going to gather all my supplies and equipment that's needed to do this head and toe assessment. Next I'm going to perform my hand hygiene. And then I'm going to apply the appropriate necessary PPE equipment. And then next I'm gonna go to the room to introduce myself to the patient. And then I'm going to secure privacy by closing the door once I get to the patient's room. And then next I'm going to, I'm used two unique identifiers to identify the patient. And then next I'm going to explain the procedure to the patient. Upon getting to my patient, I'm going to introduce myself. And then I'm allowed to check the patient's armband to use two unique identifiers. And then I'm going to explain the procedure to the patient. Hi, my name is Fred Page. I'm here to do a head and toe assessment on you. And please let me know if you have any questions throughout, okay? Okay, next I'm going to start by observing the general assessment on my patient. The patient appears to be well developed, well nourished. His height is about 5'8". His weight is about 185. His BMI is about 23. Next I'm going to assess his level of consciousness. He is alert. He's not in a coma state. He's not lethargic. He's not stuporous. Next, I'm going to do a level of orientation. I'm going to ask him, do you know what time of day it is?
2:15.
Do you know where you are right now?
At the clinic.
Okay. Tell me your first and last name.
Baldomero Gumara.
Okay. And do you know what you're here for today?
Chest pain.
Okay. Alrighty. And then after doing that orientation, I'm gonna go into doing my actual physical head to toe assessment after getting vitals. First, I'm going to gather his temp. His temp is noted as 97.7. Next, I'm going to get his respirations. His respirations about 18 breaths a minute. And also to his heart rate, it comes in about 90. And his blood pressure is 137/82. After his vitals given, I'm going to my physical head and toe assessment. I'm going to start with the head. I'm going to note that the head is normocephalic and round in shape. Next, I'm going to go to his hair. His hair is evenly distributed and is moderately thick. Also, too, his scalp is intact. It is free of vermin lesions or rashes. Vermin lesions are rashes. Also, too, I'm going to note that there's no excessive oiliness, dryness, or roughness in his hair. Next, I'm gonna go down to his eyes. His eyes are his conjunctiva is pink, and his sclera is white. The perla is responding to light, and there's no stigmas. Also, too, I'm going to have him follow this. When I move this, you follow this. Okay, cardinal gazes done. He was able to follow, and also there's no stigmas. Okay, next I'm gonna go down to his nose. His nose is symmetrical, proportionate to his face, and also to his mucosa is pink and moist, and there's no evidence of drainage or exudate. Also to I'm going to do a patency test. I want you to close your eyes and press down on one side of your nose, and I'll put this up to your nose and tell me what you smell.
Alcohol.
Okay, do the other side. What you smell?
Alcohol.
Okay. After doing that, I am going to go to his ears. His ears are symmetrical to his face, and upon looking into his ear, his TM is his membrane is pearly white, and his bony structure is intact. It is at the cone of light. It is 7 o'clock on the right and 5 o'clock on the left. Rephrase that. Wrong cone of light. On the right side, the cone of light is 5 o'clock, and on the left side, it is 7 o'clock on the left. After doing as far as the ears, I'm gonna go down to the mouth. um, say ah. The tongue is midline and is moist and pink, and there's no drainage. Also to the dentition, there's no loose or missing teeth, and there's no caries. His gingiva is pink and moist, and there's no bleeding. And also to his mucosa is pink and moist as well, and his pharynx is pink and moist with no exudate. Okay. Next, I'm going to go, after assessing the mouth, I'm going to go down to his neck. His trachea is midline. There's no masses. His thyroid is non-palpable, and there's no edema. And also too, there's no evidence of JVD, jugular vein distension, and also to feel the carotid pulse as well. Okay. Next, I'm going to, after assessing the neck, I'm gonna go down to the chest. The chest is symmetrical. And therefore, next step I'm going to listen to the breath sounds. I want to start with the right side. Deep breath. Let it out. One more. Let it out. One more. Let it out. One more. One more. Okay, now let's go to the back. Deep breath. One more. One more. Okay. And now the breath sounds were clear in all bases. And also to next, I'm gonna go to the apical pulse. Listen to it. And there's no muffle or arrhythmias noted when it comes to the apical pulse. Next, I'm going to, note the skin tugger on the clavicle. It returns within 1 to 2 seconds, no concerns there. Next, I'm going to have you go down to listen to the, check the abdomen out. So I'm gonna have you lay down, please. Okay. Note the abdomen is flat and symmetrical. And there's, for its on assessment, there's no dissection of the skin with the abdomen. There's no scars, venous patterns, lesions, striae, hernias, ecchymosis or peristalsis noted with the stomach. And then next I'm going to palpate. It is soft and is not obtunded. There's no organomegaly, as well as it's not distended. And then next I'm going to listen to the abdominal sounds, the bowel sounds. I'm gonna start with the right upper quadrant, go down to the right lower quadrant, and then move over to the left upper quadrant and go down to the right lower quadrant. I will note that that has normal active bowel sounds, which normal active bowel sounds is between 10 to 30 minutes. And if you have absent bowel sounds, it'll be less than 5 minutes. And hyperactive bowel sounds will be bowel sounds greater than 30 minutes. Okay, after listening to the abdomen, I'm going to go over to the, I'm gonna have you sit up, please. And then I'm going to move over to the upper extremities. I'm going to first note that hold your hand like this. The radial pulses are at +2, and the warm skin of the trunk is warm, not cool. And also too, I'm going to note that the capillary refill returns less than 1 to 2 seconds, and also too, the vein has rapid refilling. Next, I'm going to, for instance, the grip strength for both my hands. Okay, grip strength is equal and strong on both sides. Next, I'm gonna go down to lower extremities. Lower extremities, hair is present. There's no edema. Also, too, I would note for is the nails. The nails are not. There's some yellowing. no ingrown or yellow ingrown or thickness and the hair nail and the nails. Also too, I will test the pedal pulses on both, right, left, and they're both strong. Next, and okay, as far as the lower extremities, and then next I'm going to do a range of motion. I'm going to have you stick your arms out and do this. Okay, and then I'm gonna have you stretch your arms out like this, and then I'll push down, let it push against you. Okay, both left and right have good range of motion, and have appropriate proper range of motion, and as well as strong bilateral strength. And also too, I'm going to do with the lower extremities as well on both sides. I'm going to hold your feet up, don't let it push down. Okay, good equal strength bilaterally, and then I'll do the same thing. Stick your foot out, that side, your left side, and then spread around, and then put your down, and then do the other side. Okay, good range of motion. Don't let me push down on you. Okay, all right. And then next, I'm going to note there's no, hold your foot up, and there's no sensation in the upper or lower extremities noted at all. Okay, and then next I'm going to do a pain assessment, being that the patient came for chest pain. Have you had any, far as when it comes to terms of your pain, has it been lasting for a short period of time or a long period of time?
Sure.
Okay, basis acute pain is noted, and on a scale of 1 to 10, 1 being the weakest, 10 being the strongest pain ever, how would you rate it? Okay, alrighty, and how long does it last?
A few minutes.
Okay, and duration, when it lasts a few minutes, does it last for like 1 to 2 minutes, or does it last for 3 to 4 minutes?
1 or 2.
Okay, all right. And also too, the far as it's like short, throbbing, aching, radiating.
Radiating.
Okay. Also too, does anything seem to make it worse?
Eat.
Okay. And then anything seem to make it better?
Rest.
Okay. All right. And have you been able to sleep?
Yes.
Okay. All right. And far as with that, I would far as his skin. His skin is his color is appropriate for race and ethnicity. His texture is smooth. His appearance is free of, there's no edema. His general appearance is free of scales, rashes, or lesions. It is adequately moisturized. His skin turgor returns in 1 to 2 seconds, so there's no concerns there. Also, to terms of the skin, the temperature is warm. Okay, and next I will conclude with my six post-procedure steps. I am going to return the bed to the lowest position as possible. I'm going to raise the bed rails, and I'm going to make sure that the call light is within reach. Next, I'm going to inform him, ask him, do you have any concerns or do you need anything from me right now?
No.
Okay. And then I will let him know I'll be back within like 10 to 15 minutes, but if needed, he can call me sooner. Then I'm going to clean all my equipment that has came in contact with the patient. And then I'm going to perform hand hygiene. After performing hand hygiene, I'm going to return to the nurse's station and document the time, the assessment, the procedure, and the patient's response to completing the head and toe assessment. And that concludes my head and toe assessment. Thank you.